sentences, grammar, and structure. Sentences, grammar. So, take your notebooks, pencils, and everything. So write your problems related to speaking and writing, because this is the area where we are going to use productive skills. Productive skills. Yeah, write down your problems related to writing and speaking, sentence construction, grammar, what all problems you have, write everything, because we are going to deal with them now. We are going to deal with them now. Write down all your problems related to writing and speaking. Writing and speaking, write all your problems. Write about your problems related to writing and speaking. all your problems are going to be discussed today. It's a long marathon. Lot of things you are going to learn. So today and tomorrow the sessions are free. So invite all your friends, as many as possible, because from day after tomorrow it will be only to the regular students, because the admissions are already going on. And once the admissions are finished by tomorrow, Sunday, midnight, 12 o'clock, this schedule will be posted, and then the classes will be conducted for the regular students. So now students have gone for exams, so I am free. So I am providing free sessions for 2 days, weekend. So write all your problems. Last 2 minutes. Yes. Kamalesh, very good. Dr. Kamalesh. That's good. What about the others? You don't have any problems? You don't have any problems? Let me know if you have any problems. Okay. It's 5 p.m. We are starting. 1700 hours Indian Standard Time is now. Okay. Now, first one is, what we are going to do is sentence structures. How are we going to learn the sentence structures? Okay. Sentence structures. The foundation. The foundation. This is very important. The foundation. Right. This is the foundation. Yeah, the foundation. We are going to build some foundation, sentence structures. Foundation. Right. So, if we study carefully the sentence structures, okay, try to write one sentence without any mistake. Just one sentence, either in writing or speaking. Take any one sentence, write one sentence without any mistake. I don't want to see any mistake in your think, take your own time. You take 1 minute, 2 minutes, 3 minutes, 5 minutes also, no problem. But see that the sentence doesn't have any mistake. So that is called preparation and planning. Don't hurry and throw your words in sentences. Try to think. No need to write 5 sentences which are faulty. Write one sentence which is excellent. So now the test for you. If you cannot write one sentence now, okay, then that means it's difficult. You're going to do many mistakes in the test. So sentence structures. Come on, write one sentence, just one sentence. The sentence should have at least 10 words. 10 words. The sentence should have at least 10 words, mind you. At least 10 words. Okay. So at least 10 words. The condition is 10 words. And among those 10 words, there should be at least 5 words which have at least, okay, the conditions I'm telling you, at least 7 letters. At least 7 letters. 5 words should be there. Okay. One sentence, 10 words. So the point is here. What is the point? The conditions are here. What are the conditions here? The conditions are, number 1, one sentence. One sentence only you have to write. And there should be one sentence, 10 words. One sentence, 10 words. And then at least 10 words. One sentence only you have to write. Conditions are there, not just like that. 10 words at least. And next one is 5 words should have more than, is equal to or more than 7 letters. Okay. 5 words should have at least more than 7 letters. And 2 words should have more than 10 letters. That's it. These are the conditions. Now dance. Now dance. This is called quality. Just write something meaninglessly. So meet the target. Meet the target. Right. So one sentence you cannot write. Is it possible like that? The doctors and nurses. So come on, dance. So one sentence only you have to write. 10 words at least. 5 words should have 7 letters. And out of them, 2 words should have more than 10 letters. Okay. Come on, I'm giving you 3 minutes or 4 minutes and no mistake. See that? Okay, mistakes will be there. But see that no mistakes. Without mistakes. Without mistakes. Try. Yes, there you are. I'm giving you 3 to 5 minutes. I'm giving you. Just try your best. I'm not asking you to write too many things. I'm asking you to write only one sentence. Yes. Yeah. Let's write the sentence. So those who are writing these things, that means they are ready for challenge. And you are going to master the skills of speaking and writing today. If you can write one sentence properly, that means you can write any number of sentences properly. Because we concentrate on sentence after sentence. Focus not on sentences, focus not on words, focus on correctness. Yes. So, anybody has written? Try. Yes, one person has written the answer. Let us check it. Kamalesh. Yeah, right. But after gathering, there should be a comma. Otherwise, it is right. After gathering and between gathering and which they are relative pronoun. So noun and relative pronoun. So you have to put a comma there. Right. Yes. Fine. Okay. Now let us see the sentences. Okay. Let us see the sentences. Yes, this is day 1. Okay, now we are going to day 2. New Microsoft Word OET Grammar Capsules episode not 2. Yeah. Yes. Now let us see how to write a sentence. Yeah. How are we going to write the sentences? Okay. There we are. So now let us take some point, okay, and be very cautious, okay. Concentrate on each and every point which is going to be told. Right. Sentence formation. Sentence formation. So we are going to deal with the basics of sentences. Now, sentences you can write in different ways, but the most important thing is the subject. Subject is the most important thing. Now, what is this subject? Subject is the central focus of something, someone, or something which is of utmost importance. The subject, yes. The first one is the subject. The subject. The subject is the central focus or someone or something which is of utmost importance. the central focus of someone or something which is of utmost importance. Now, always, okay, always what you do is, okay, think about some points. Okay, think about some points. Okay. Okay. Right. Now there you are. Number one. Right. Now, what is the subject? Subject is you can talk about the person or you can talk about the thing, the person or thing. Right. The person or thing. For example, you say, let us take one case notes. Let us take one case notes. Writing case notes. Yeah, here it is. Lionel Ramamurthy. Lionel Ramamurthy. This is one case notes for nursing. And in the same way, we'll take one case notes for writing, medicine. Okay. So writing case notes for medicine. So yeah. Yeah, medicine. Right. This is for medicine. So because there are doctors and nurses, we are taking this one. Now, try to focus on the most important point. Any one you can take. So first, let us take the nursing case notes. So let us take pneumonia. Pneumonia. So this is the point. Diagnosis is pneumonia. Diagnosis is pneumonia. This is the point. Okay. Diagnosis pneumonia. Now we are going to write about this. Right. Now write down what you want to write. And the name of the person is Lionel Ramamurthy. Lionel Ramamurthy. Yeah, you can write a sentence. You can write in. Okay. Come on. Write the sentence. Write one sentence. We will do sentences mistake without mistakes. So like that. So what is important here? Here there are many people. Okay. There are many people here. Number one. Okay. Number one is the person who is writing the letter. The person who is writing the letter. Number two, the person who is receiving the letter. And number three, the person who is the patient concerned. Okay. The patient concerned. Okay. The person who is the patient concerned. That's it. Then the disease which is noticed. The disease of the patient. Okay. The disease of the patient. Okay, now here the person. This is the person. I told you someone or something. So these are the three persons involved. And there is only one thing involved. Okay. Now many people write many ways. So whom are you giving importance? If you are giving importance to this one, then you write like this. The person who is writing the letter. For example, a doctor is writing or a nurse is writing. Okay. The doctor. Okay. The doctor. The doctor diagnosed the patient. Okay. The doctor diagnosed the patient. So the person who is receiving the letter. So this will not come here. So the doctor only is writing. So I am writing to refer. I am writing to refer Mr. Lionel Ramamurthy. I am writing to refer Mr. Lionel Ramamurthy. Okay. I am writing to refer Mr. Lionel Ramamurthy. Okay. Fine. So like this you can start. I am writing to refer Mr. Lionel Ramamurthy, who was diagnosed. Okay. That is it. Number one. Next one. He was diagnosed with pneumonia. Okay. Right. Check it out. I'm writing to refer Mr. Lionel Ramamurthy. Okay, he was diagnosed with pneumonia. So that's it. Next, this sentence. Second sentence. The person who is receiving the letter. Okay. The person who is receiving the letter. So them also you bring in the middle. I am writing to you to refer Mr. Lionel Ramamurthy. All are correct only. Lionel Ramamurthy. Okay. I am writing to refer Mr. Lionel Ramamurthy. Full stop. Okay. Full stop. I am writing to you to refer Mr. Lionel Ramamurthy. He was diagnosed with pneumonia. Okay. That is next. Number 3. Okay. And next one, the letter which is being written. Okay. The next one is the letter which is being written. The letter which is being written. So this many different styles you can write. There is no problem. Okay. The letter which is being written. Okay. Now here you will say like this. I am writing a letter to you to refer Mr. Lionel Ramamurthy. Full stop. He was diagnosed with pneumonia. Or you can say pneumonia was diagnosed. Pneumonia was diagnosed, or he was diagnosed. The doctor diagnosed him with pneumonia. Okay. Now let us. Next, the person who is the patient, concerned. Okay. Now, so you're starting like this. Mr. Lionel Ramamurthy. Mr. Lionel Ramamurthy was diagnosed with pneumonia. So here, Mr. Lionel Ramamurthy was diagnosed with pneumonia. He is being referred. He is being referred for something. Okay. Now the disease of the patient, you can write using disease of the patient. Okay. Pneumonia was diagnosed for Mr. Ramamurthy. Okay. Pneumonia was diagnosed for Mr. Ramamurthy. Okay. He is being referred for. So like this. So all are right only. All are correct only. All are correct only. Right. Nothing is wrong. Everything is right. Everything is right. Now, what is the problem in this area? What is the problem in this area? Here, you are writing I. I is a danger zone. I is a danger zone. I. So, writing, no need. I am writing. So, this is a danger zone. No need. Everyone understand. This is called redundancy. Redundancy. Okay. I am writing a letter. Everyone knows that it's a letter. So these words, I am writing a letter to you. Till here is no need at all. Okay. There is no need. Correct. Sentence is correct. There is no problem with the sentence. There is no problem with the sentence. So how are you going to write these sentences is more important. So first write small sentences. Okay. Now we are going to learn the sentences. Okay. Now, sentences. Okay. I'm going to give you 1 point. Okay. Sentence number 1. Okay. First, what you have to do is you have to take the subject. Take the subject. First, take the subject. Number 1, procedure, how to write the sentence. Procedure to write the sentence. Okay. Procedure to write the sentence. First, take the subject. Then, okay, subject is very important. Then take the verb. And take the verb. Okay. Take the verb. Next, check the tense of the verb. Take the tense of the verb. Okay. Take the tense of the verb. Then next one. Check the number of the sentence of the subject. Check the number of the subject. Means singular number or plural number. Next, number 5. Number 5. Okay, check the agreement of the subject with the verb. This is called subject or verb agreement. This is the most important subject verb agreement. This is the most important function in English. Subject verb agreement. Subject verb agreement. How they are matching. These two are important. All others are extra. Then provide the extra information. All others are extra information. Okay. So take the subject, take the verb, check the tense of the verb, check the number of the subject, and check the agreement of the subject with the verb, and provide the extra information. Okay. Now, check the final sense. So these are the 7 points you have to follow. If you follow these 7 points, it will be very easy for you. Now let us see how we are going to write. Right. The medications were commenced. Now see here, the medications were commenced. The doctor commenced the medications. Now this is the actual sentence. The doctor commenced the medications. Okay. The doctor commenced the medications, or the patient commenced the medications. So who commenced is not important. The medications were commenced, whether doctor commenced or patient commenced or somebody else commenced. That's not the point. The medications were commenced. So this is the way how you are writing. The doctor is the subject here. Commenced is the verb. And the extra information is the medications. But is the doctor important? The doctor only will commence the medication. The doctor only will commence the medication. So this is not important. So use the passive voice. The medications were commenced. Okay. The medications were commenced in brackets by the doctor. We can understand that is not needed. The medications were commenced by the doctor. That's understood. Okay. When. Okay. When. That is all these things. When, where, why, how, what medications. All you can write afterwards. Okay. So now check everything. This is the way how you are going to write the sentence. This is the way how you are going to write the sentence. Now write sentences like this. Okay. Write active voice sentences first, then we'll see passive voice. Okay. Now let us take the examples like this one. Number one. So you have to use the words which I am giving you now. Okay. You can say education. Okay, that is number one. Next one is counseling. Number two, then physiotherapy. So these are the words which you have to use. Education, counseling, physiotherapy. So next one. Don't need to write too many things. Write small sentences. Write small sentences. Okay, no problem. Write small sentences. Yeah, write down the sentences, please. Okay. Education, counseling, physiotherapy, insulin injections. Take anything. Insulin injections. Then next you can say low fat diet, low fat diet. So make these important. Okay, low fat diet. You write active voice or you write passive voice. First, learn how to write the sentences. That's all. Yeah. So come on, start writing. Physiotherapy was recommended for the speedy recovery. Full stop. Full stop is missing. Full stop is missing. Physiotherapy was recommended for the speedy recovery. Okay. I will book physiotherapy sessions for my patient. Okay. Raymond Tunje. I will book physiotherapy sessions for my patient. That's okay. That's correct. Sentence is correct. Okay. First, let us learn. Then afterwards, we can see quality sentences. Okay. I will check your sentences. Fine. So others also can write the sentences. So low fat diet. I'm giving you practice now. I'm giving you practice. Yeah, low fat diet. Then next one is so ambulation. Ambulation. So use these words and create one sentence each. Right, big or small, no problem. Okay, that's not going to be any problem at all. Okay. Right. Activities of daily living. Activities of daily living. Activities of daily living. Write down all of you. Okay, all of you write down. Many people will come now, slowly, slowly. Activities of daily living. Okay. Activities of daily living. Next, what else we can talk here? Then regular monitoring. Regular monitoring. Okay. Regular monitoring. Okay. Regular monitoring. Then regular monitoring. Yeah, regular monitoring. Write down the sentences. Write down the sentences, please. Don't wait. Okay, regular monitoring. Regular monitoring. Next one is right. Write down on your own, whatever you think you can write, no problem. Okay. Body mass index. I'm just giving you some sentences. You write what so many letters you might have. Okay. Body mass index. Body mass index. Body mass index. Weight reduction. Weight reduction. Minimizing alcohol consumption. Minimizing alcohol consumption. Minimizing alcohol consumption. Okay. Minimizing alcohol consumption. Yeah. Miss Taylor has been advised. Miss Taylor, remove the full stop. No need. Miss Taylor has been advised on the importance of low-fat diet. Full stop. One full stop. Remember, another full stop at the end you put. Okay. The next one. So these are the points which I am giving you. Write down. Minimizing alcohol consumption. Okay. Then, okay. Unremarkable. Unremarkable. Okay. Unremarkable. Use this word. Unremarkable. 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 Excessive fluids. Excessive fluids. Next, nutritious diet. Nutritious diet. Nutritious diet. Regular physical exercise. Regular physical exercise. Regular physical exercise. Regular physical exercise. Come on, write the sentences because everyone, Mr. Kamalesh and Mr. Raymond, only two are writing. What about the others? Okay. Write down, no problem. Practice. Yeah. Yeah. So these many sentences I have given, right? Think and write. Because we are going to correct all these sentences. No? Weight reduction. Right? Whatever you want to add, you write. Name you can add, place you can add, timing you can add, condition you can add, doctor's name you can add, patient's name you can add, medication name you can add. Okay, what time you can add, anything, anything. Wonderful sentence, Kamlesh. Lifestyle modifications like reducing weight, healthy diet, and low consumption of fats were recommended. So, low consumption of fats were recommended. Yeah. Come on, come on. Those who are writing will improve and go. Those who are not writing, they'll just be staggering behind. That's not my problem. That is your problem. Learn, 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 write. Active participation is important. Active participation is important. Come on. Lifestyle modification. Oh, yeah. Come on. So each one, take 1 point and write 1 sentence. Take 1 point and write sentence. I'm giving you these points only will come in the exam. Don't think that these are waste, okay? Chest blood test results were unremarkable. Unremarkable is enough. That is normal. Okay, unremarkable means normal. Normal means unremarkable. Why both? Any one is enough. Okay. Come on. Any mistakes are there, I'm correcting. So you can make notes and keep all these sentences and you can learn these sentences. These only you are going to write in the exam because I'm going to improve all these sentences. Yeah. Slowly, slowly, students will increase now. Okay. Yeah. Raymond, her chest blood test results were unremarkable. Full stop. That's enough. So these are sentences without mistakes. Very good. I'm correcting. If anything mistakes are there, I'm telling you. Okay. So now I have to be behind these students. I think I have to tell them right. Okay. Lara, you can write the sentences. Anjana, you can write the sentences. And 1 plus. Please write your name so that I'll know who you are. Yeah. So regular physical exercise. Then next is okay. Yeah. Okay, postural drainage. Yeah. Postural drainage. Postural drainage. Okay. Postural drainage. Okay. Postural drainage. Next. Right. Encourage chest physio or exercises. Encourage exercises. Encourage exercises. Anything you write, no need to write that one, this one. Write whatever comes into your mind, you write. Even without seeing the case notes, you write whatever you want. No problem. We want only sentences. Nah? Encourage exercise. Counseling on complications of the procedure. Counseling on the complications, Dr. Kamlesh. Counseling on the complications of the procedure. And also the prognosis of her condition was counseling on, and also the prognosis were given, not was given. Were given. Counseling was given and prognosis were given, was given. Two were given together. More than one. More than one. More than one. So were given. I'll give you all these corrections afterwards. So write all mistakes you write, no problem. I'll correct and improve your sentences and give you. If you don't put the input, then what I can do? Okay. Hmm. Yeah, next one. Encourage exercises. Then next one, ambulation. Okay, encourage oral fluids. Then weight gain, dry cough, slow but independent walk, showering and toileting. So slow but independent walk and shower, toilet. Okay, Mr. X, Laraib, very good. Mr. X. Why do you want to write X? Write some name, na? Mr. John. Don't write half things. No problem. Mr. John. Write down something. Some name you write, na? Mr. John has been referred to you under your locality for further management of regular monitoring of blood sugar levels. Okay, Mr. X has been referred to you for further under your locality. No, that will not come. Mr. X has been referred to you for further management of blood of further management of regular monitoring, further management of further regular monitoring and further management of blood sugar levels, like that you can say. Next. Fine, you have tried your level best. That's fine. That's fine. There's no problem in this. So, right. Mr. John has been referred to you for regular monitoring of blood sugar and further management. Under your in is not needed, under your care. The next one. Okay. Medicine. Allergies. Codeine, dust mite, sulfur dioxide. Okay. Allergy. 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 You can use the one word allergy and write your own sentence. Allergy. You know what you have a lot of experience. You can write. Allergy. Then mother and father, hypertension and peptic ulcer. Okay. Family history. You can write any family history. One sentence regarding family history. Okay. Okay. Then you can say minimizing excessive alcohol consumption. Excessive alcohol consumption. Excessive alcohol consumption. Excessive alcohol consumption. Slowly, slowly, students will come. No problem. You carry on. All these points I am giving you here. Okay. All these points I am giving you. Okay. Take any point, one by one you write. No problem. Slowly you write. No worry. Okay. Right. Excessive alcohol consumption. Very good, Nimra. Dr. Nimra. I think Dr. Nimra wants to join the sessions on a regular basis. Very good, Nimra. I think I got your message, but I said I'm in a class afterwards. I'll talk to you. I don't remember exactly. It is you or somebody else. Nimra. So 3 or 4 doctors have asked me, but I'm just checking who is really serious, because I'll take only 3 people, no? Only 3 doctors. Okay. Yeah. Yeah, it was you only. Okay, fine, fine. Yeah, I'm just checking for 2 more days. Once that is done, then I will confirm the admissions who are regularly attending, seriously practicing, because this admission is very important. So I know you are serious. That's why you came to me. But I want to confirm to myself. And you also will know in the meantime. 2 days is very good for you to understand what type of teacher I am. Whether I'm going to play the fool, or whether I'm going to train you properly, or I'm going to take you to task and clear it in the first attempt itself. You will understand, because admission, why should we hurry? Where will you go? Where will I go? No problem. Okay. So nurses seats, only one is left now. Doctors, 2 more are there. Okay. So excessive alcohol consumption. Next one. So social drinker, mainly spirits. Social drinker. Social drinker. Social drinker. Social drinker. Regular smoker. Regular smoker. Regular smoker. Urinary incontinence. Urinary incontinence. Okay, non-compliance. Medication non-compliance. These sentences only you will write in the exam. Be sure. I'm going to give you some 50 sentences. Only those 50 sentences you write in the exam. And from that one, you can select some 12 to 15 sentences and your exam is over. That's it. The answers will be straight on the mind. The answers, yeah, 11 students. There were only 4 students. Now there are 11 students. Very good. Strength is increasing 3 times now. Yeah, Rajya Lakshmi is there. Good. Here you'll get regular practice, Rajya Lakshmi. Very good. Okay. So next, medication non-compliance, urinary incontinence. That's fine. Then prescribed, prescription, prescribed. Okay, medication was prescribed. Okay, next one, use the word recommended. Next, use the word advised. Next, use the word suggested. Okay. Suggested. Then next one is information provided. Information. Okay. Information. Then next one is forgetfulness or absent mind. No, that's don't what. Yeah. Lara, very good. It would be greatly appreciated if you could encourage her for daily life activities and importance of regular physical exercises. Okay, that sentence is fine, but it's very ordinary because everyone will write like that. So it would be greatly appreciated if you could remove that, all those things. Encouragement for daily life activities and education. Encouragement for daily life activities, regular activities of daily living. Okay. support to perform activities of daily living and counseling regarding regular physical exercises would be profoundly beneficial, like that one. That's better. I'll give you the sentence. Janu, very good, very good. Yeah, I'll correct your letter. Don't worry. I'll correct your letter. So, right. So next one. So it would be greatly appreciated if you could encourage her daily life activities. So what you can say is encouragement for performing activities of daily living and counseling for regular physical exercises, motivation. Okay. Motivation for regular physical exercises, participating in regular physical exercise would be profoundly beneficial. This is the sentence which you can use. Okay. Yeah. Next one. Beneficial. Beneficial. Don't say appreciated. Why should we appreciate somebody to do this work? Yeah, beneficial. Okay. What would be beneficial? Then next one. Overweight. Overweight. Body mass indicates overweight, obesity. Okay. This is allergies. Medical history. Two things are there. Suppose, how will you write? Okay. And next one, presenting complaint. Presented with the complaint of. Okay, presented with the complaint of. Admitted. 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 Presented. Admitted. Presented. Then next one is admitted. Presented. Next one is upon admission. Upon admission. Upon admission. Then during hospitalization. During hospitalization. Okay. During hospitalization. Right. Try to write each one sentence. Okay. And next one is signs and symptoms. Signs and symptoms. Okay. So upon capital letter, because it's the beginning of the sentence. During hospitalization is capital letter because it's the beginning of sentence. Others are not beginning, so that's why I put small letter. Signs and symptoms. Or you can say preliminary diagnosis. Preliminary diagnosis. Preliminary diagnosis. Preliminary diagnosis. Preliminary diagnosis. Okay. Next, a definitive diagnosis. Definitive diagnosis. Definitive diagnosis. Definitive diagnosis. Hello, John. Definitive diagnosis. Yeah, I have pharmacists. Yeah, I teach pharmacists also.
You have?
Yes, I have.
What is the package?
Yeah,
What is the package?
I'll tell you afterwards. I'm in the session now. I'll message you.
Okay.
Okay, definitive diagnosis, preliminary diagnosis, definitive diagnosis, and immediate assessment, urgent admission, immediate assessment, urgent admission. Okay, then brought in by ambulance. Rajalakshmi, daily living, Living. By mistake, you have written living, or maybe typing fast, your computer pulled the spelling. Living, daily living, Living, Rajalakshmi. Computer mistakes happen. Maybe it is because of that, or absent-mindedly you have written. No problem. Mistakes we can do. No worries. We are learning. So nobody gets offended. Nobody get offended if I'm correcting. That is for you. I'm speaking very slowly, means I'm in deep. Okay. I'm in the depth. Right. Next one. Yeah. Urgent admission. The next one. Recent increase in coffee consumption. Refer to gastroenterologist. Referral to the a referral to the has been provided, or scheduled. Then scheduled. What is scheduled? An appointment for review. A review has been scheduled. An appointment has been scheduled, or removal of staples. Removal of staples. Okay, removal of staples, anything like that. Removal of staples on so and so date at so and so after 2 weeks has been. So everything will write these sentences. Removal of staples after 2 weeks at the in the hospital outpatient department has been scheduled, like that. Create your own sentence. One point I'm giving you, you have to imagine like that. You have to imagine like that and write. Imagine the situation, imagine the circumstances and write. Then next one. Take these points, that is fill in the blanks. You have to write. Fill in the blanks, you have to write. Then next one is over the counter. Okay, self-medication. Self-medicated with over the counter product, something. Okay. Self-prescribed. 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 Or self-medication. Self-medicated or self-prescribed. Over the counter. Okay. Over the counter. Over the counter. Self-treated also. Yeah, self-treated, self-medicated, self-prescribed, anything. That's fine. Over the counter. These only will go into the exam. Okay. Based on my experience, I'm training you here. These only will go into the exam. Okay, most of them. Okay, over the counter product. Over the counter product. Medication or whatever. Okay, over the counter. The next one. Provisional diagnostic. Okay. Reduction in alcohol and coffee consumption. Cease. Cessation. Cessation of something. Cessation of or seizing over the counter product. Cessation of something. So you have to stop. Cessation of alcohol consumption. Smoking cessation. Yeah, prohibited, strictly avoid. Come on, bring out all those things. Nadeem, if you can write the sentences, it would be even better. Yeah. Then next one, 44. Then next one. Right. Right. Okay. Next. Next. Now we'll take some more things. So, case notes, writing. Writing, medicine. Writing, nursing. Yeah. Okay, next one is commenced. It we write the word commenced. Education, counseling, instant, excessive, recommended, prescribed. Yeah, one more word is commenced. Commenced. And next one is recuperation or recovering. Recuperation or recovering. Use the word underwent. Some people write has underwent. There is nothing called has underwent. Has undergone. Present perfect means underwent. You can write this one, or if it is present tense, has undergone. But it's always better to do underwent. Underwent. Recovering. Recuperation means recovering. So then you have to go to father. Father means Cambridge Dictionary. Okay, if you don't know any word, this is the place. Recuperate. Recuperate. Recuperation. So to become well again after an illness, to get back to your normal condition, to get back to your strength, health. This is very special word. Okay, this is very special word. Recuperate. The very special word. Recuperation is the noun form of it. So recuperation, uncountable. The process of becoming well again after an illness or of getting back your strength, health, etc. So this is very important word. You can take this word. Okay. So I'm giving you the link here. Okay. You can save it. Then next one. So these are the words which are very, very important. Then next one. Recuperation. Yeah. Then so we have seen the three things. Monitoring medications, monitoring screen for diabetes, dietitian advice, lower cholesterol, continue physio and language therapy, screen for depression. So all these things repeat again, time and again. Encouragement, pleasure and social activities. Encouragement, encouragement to participate in social activities or establishing income generating activities. Establishing income generating activities. Income generating activities because they are poor, they don't have money, so they should do something. Encouragement. Encouragement. What encouragement? So here, encourage for what? Encourage leisure and social activities. Encourage participation in social activities. Participation in social activities. Okay. Participation in social activities. Establishing income generating activities. Okay. Then next. Yeah. All these sentences we are going to write now. There is no excuse. We have to write all these sentences. And those sentences only we'll discuss. Because these sentences only you'll be writing in the exam, I told you. So 49. Then next. Treated immediately, admission, supplemented. Okay. Withdrawn. Earlier medicine will be withdrawn and some other medicine will be substituted. Substitute medicine, withdrawn and substituted. Okay. Substituted, withdrawn. The earlier prescribed medicine will be withdrawn because it is showing negative impact and therefore substituted with some other medication. Okay. Instead of some medication, you give some other medication. Dr. Kamlesh Inteti. Doctors are there. Many doctors are coming nowadays. Dr. Nadeem. Okay, I expect you to write these sentences. Dr. Nimra. Okay. Nimra. Then next one, Dr. Kamlesh. Write these sentences, please. Okay, these are okay. You can write better sentences because you will withdraw the medication and give some other medication like that. Then next one. Next one is yeah. Right. Inspection of the surgical site and maintaining it clean and green. That is okay. Surgical site. Surgical site. Okay. Surgical site should be clean and green and dry. Something like that. Surgical site. This is also there. Okay. Regular inspection of the surgical site for infections. Okay, infections. Check for infections. Surgical site. Regular monitoring of the surgical. Regular checking. Okay, checking for any infection. Infection of the wound. Infection. Okay, infection. These are the words which will come. Okay, oral antibiotics were withdrawn and substituted. Wow, Kamlesh, very good. Oral antibiotics were withdrawn and substituted with intravenous medications. Very good. Excellent. You have improved, Kamlesh. Lot improved. Now you're thinking lot. Full stop. Question. Capital letter. Everything you are concentrating. That's what I liked it. That is called, obedience to the calling, not to me. Obedience that you want to learn more. That's what it is. Serious. Okay. Yeah. Infection. Then infection. Then screening for swallowing, upper extremely weakness. So treated immediately. Allergies, never smoke, family history, surgery on ankle fracture, vitreous detachment, left side ischemic stroke. Yeah. Then advice, suggestion we have given, monitoring we have given, supervision. You can say supervision, regular supervision. Okay. Monitoring, supervision, observation, anything you can write. Okay. Then next, she was diagnosed with a surgical site infection. Yeah. Surgical site infection was diagnosed. Surgical site infection was diagnosed. That's enough. She is not needed. Dr. Nadeem, quality, improve the quality. She, personal pronouns, you can remove. You can remove the personal pronouns. Yeah, John is there. Very good. And you can call your other friends also. I have already given the link. So, Jansi, you can call your other friends. Just message them because I cannot invite each and everyone personally. So, you can help me. Tell them that there are good sessions going on here. Okay, because this is just the beginning. This is just the beginning. Okay. If you learn these things, you'll be outstanding. Not everything is not needed. Blindly don't go. Prepare everything and go. That's important here. Then next one is role play cards. 1, 2, 3 standards. Writing. Capsule official guide. Capsule official guide. Yeah. So official guide, writing, listening, reading, writing section. Yeah. So what are the other important things which we'll see here? There. See here, many people say if you write spelling mistakes, okay, you'd say, don't listen to anybody if somebody says. This is the point. Appropriateness of language. Okay. Appropriateness of language. Remember that. Okay. So spelling is very important. Okay. Spelling. Okay. See here, you must avoid spelling errors. You must avoid spelling errors, use correct punctuation, and use clear letter layout. Margins also is important. Layout means margins. Punctuation, full stop, comma, everything. Okay. Oral antibiotics have been withdrawn, Nimra, have been withdrawn and are substituted with intravenous antibiotics. Okay. Okay. Intravenous antibiotics is needed there. Okay. Have been withdrawn. Okay. Right. So next one. Now let us see here. Okay. And next one. Reported. Complaining. He complained. So you can say reported or complained. Okay, reported. What was reported? Reported. Or complain. He complained about something. So something was reported. He complained about headache. He presented with the complaints of headache. Headaches were reported. Finished. Why so long? Reported. Informed. Okay, information was provided. Reported. Okay. Yeah. So next. Surgical site, Nimra, the surgical site, that particular surgical site. So definite article, the is compulsory. It's not just surgical site, it's the surgical site. Infection. Infection at the surgical site infection. Surgical site infection. Yeah, that's fine. Wait. Infection at the surgical site, but surgical site infection. Fine, that's enough. No problem. That's correct. All right, next. So, next one. No supplemental oxygen required. Develop central line. Okay, oriented to orientation. Orientation to 4 types of orientation. Orientation. What is orientation? Orientation to time, place. Time, place. 4 types of orientation. Okay. 4 types of orientation. What are those? 1 minute. 4 types of orientation. Time, place, day, and date. Is that orientation? Orientation. Four types of orientation. Oriented 1, 2, 3, and 4 mean in dementia. Okay, the 4 types of orientation are 4 types of orientation are okay, awareness of self, place, time, and situation. Person, place, time, and situation. Person, place, time, and situation. Person's level of awareness. Person, place, time, and situation. These are the 4 levels of orientation. Orientation, 4 levels of orientation. Person, who he is. He forgot himself or who he is. He forgot others or who they are. He doesn't recognize anybody. He doesn't recognize anybody. Persons. He does not recognize himself. He does not recognize others. That is person. Where he is. That is place. What time it is. What time it is. And what situation he is in. So these are the 4 things. Okay, 4 things. Person, place, time, and situation. These are the 4 types of orientation, right? So you can write these things. So if you know this one, then you can write there. So dementia patients, especially dementia patients, okay, oriented. Okay. So this is anxiety and depression. You can see here, anxiety and depression. Okay. hypertension, hypermigraine, okay, anxiety and depression. So oriented to place, person, place, time, and situation. See here, right? Slow to respond. He will not respond very fast. He's very slow to respond to these four orientations, four types of person, place, time, and situation. That's it. Okay, he does not, he sees people and he cannot recognize immediately. He takes time to recognize person. Where he is. After getting up from bed, he doesn't know where he is, like that. Any place. Suddenly he cannot remember where he is. And he does not know what time or what day it is. Or what date it is, time. Then situation, what situation he is in. Is it in pleasant situation or worrisome situation or difficult situation, or what type of situation he is in. So orientation. So you are learning new things now. So this one, remember, oriented to person, place, time, and situation. That is what I have given here. Okay, orientation to person, place, time, and situation. Okay. So slowly, you will be learning many secrets. Okay. Unstable. So stabilized. Stabilization of sugar levels. He was admitted for the stabilization of sugar levels, insulin. Okay, sugar levels. He was admitted for stabilizing sugar levels, for the stabilization of sugar levels. Okay. For the stabilization of sugar levels. Right. Stabilization of sugar levels. Every letter, these definitely will be there. Whatever points I am writing, all the points which are there in your letter will be something, or here I'm going to give you some 100 words. So among these 100 words, only 15, 20 you will write there in the letter. That's all. So you have to be ready with all the things. Okay. All these are problems. All these, whatever I have given you, are only problems. Only problems. Only problems. Education should be given because he does not know. Counseling should be given because he lacks knowledge. Physiotherapy is needed because to develop his condition. Insulin injections, uncontrollable. Low fat because he's high fat diet. Ambulation is not possible. Activities of daily life not able to manage. Regular monitoring because he cannot do on his own. Body mass index is high. Weight reduction, that is what it is. Minimizing alcohol consumption because he's consuming more. Unremarkable, so make it remarkable. Okay, excessive fluids should be less. He's taking less fluids. He cannot eat properly, so excessive fluids. He cannot swallow properly, so fluids. Nutritious diet, lack of nutrition. Regular physical exercises. He's not exercising properly. Postural drainage is not well, so he has to encourage exercises. Allergy. All these are points which are okay. Urinary incontinence, medication non-compliance, prescribed because something is needed. This is for the solution because there is a problem. Recommended, advice, suggested, information, beneficial. So all these words are related to the problems. Okay, if you can manage these things, okay, you can manage everything else. Then oriental, unstable, stabilization, antihypertensive medications. Okay, medications. So medications. What type of medications? Medications for pain relief. Maybe pain relief. Medications. Okay, pain relief. See, I also do spelling mistakes. Pain relief, maybe speed, whatever it is, that is not my problem. That is not anybody's problem. So it is my mistake only. I leave it like that means it's my mistake. So I have to be check and cross check. Pain relief. Then next one. Then regular checkup, regular monitoring. Then encouragement, assistance. Another word is assistance or support. Assistance has to be provided for performing activities of daily living. Assistance has to be provided for performing activities of daily living. Finished. Okay. Next one. Requires assistance with feeding. Assistance. See, this word, repeated words are important. Required. See, required. Okay. Required. Assistance is required. Okay. Required is another word. Compulsory. These words must go into the exam. That's all. Medications. Okay. Progress. Recuperation. Okay. Then next, discharge to rehab facility. Continue nursing management. Okay. Management. Further management or ongoing management. Okay. Appropriate care. Okay, regular monitoring we have already written. Regular monitoring. Yeah, regular monitoring here. So you should remember what you have written and what you have not written. Okay, regular monitoring. So this is how it goes, right? Regular monitoring. Fine. Yeah. Then next. Yeah, Bethany Taylor. Hypertension for this schizophrenia. Disability allowance. Financial conditions. Okay. This is another one. Financial conditions. Financial conditions. Financial conditions. This is one more. That means he has he survives on a pension. Survives. So this is survival. Okay, money, survival, financial conditions or pension. Okay, retirement benefits or whatever it is. Survival. How is managing the condition? Okay. Then self-admitted, not compliant, non-compliance, medication, decompensated, admitted, visual hallucination, delusion. Okay. Observed, noticed, observed upon examination, you can say. Observed upon examination. Upon examination, comma, U capital letter, upon examination. Observed, noticed, observed, noticed, found, discovered, noted. Okay. So any one word you can take, 2, 3 words, 2, 3 sentences, 2, 3 different words you can use. Then next one is, yeah. So next one. Rest is organized thinking, blocking or latency. Minimize delusion. Minimizing something, maximizing something. Okay. So minimizing and maximizing, you can take. Minimizing alcohol consumption and maximizing nutritious diet. Minimizing dash. Minimizing dash and maximizing dash. So you have to increase something and you have to decrease something. Minimizing alcohol consumption and maximizing nutritious diet would be profoundly beneficial, like that one. Compare and contrast. This is reducing, that is increasing, like that. Quality sentences you can write. Minimize. Activities of daily living. Did we write activities of daily living? Activities of daily living. Okay, activities of daily living. Here it is. Yeah. Then next one. Assessment, evaluation, observation. Assessment, evaluation, observation, examination. Assessment. Then evaluation. Then assessment, evaluation, examination. And just now I told, what is that? Observation. Okay. Right. Then next one. Ensuring medical compliance. Ensuring means positive. Make sure. Ensuring something. Okay. Ensuring something. Then okay. Yeah. So pain persisting. persist. Pain persists. Pain persists. Pain persists. Pain relief is not there. If pain persists, condition. That is one. So then next one. Origination and radiation. Originating from and radiating to. Remember this one. This is another one. Originating from and radiating to. Radiating pain. Originating where and radiating to. Originating from and radiating to. So be careful with these words. Originating from means starting from where, and radiating to where, moving towards where, radiating to somewhere. So that is it. You see here very carefully. Okay. Originating and radiating to. Then next one means starting at some place and moving to another place. Pain. Okay, T2, T12 vertebrae, like that one. Then resumption. Resumed. Resumption means continue. Resumption of driving. Resumption of. Okay, here you can see sexual activity can be resumed. So resumption of sexual activity. Okay, after 2 weeks. So fortnight, you can say fortnight. So resumption. Okay, resumption of normal activities or daily activities. Okay, refraining from or avoiding. Refraining. Okay, or brackets avoiding, prohibiting. Okay, refraining, avoiding, prohibiting. Resumption, continuation after some break, that is called resumption. Okay, continuation. Recommence and start again, that is called recommence. Continuation means recommence. Recommence. Stopped and started again is called recommence or continuation. So these words you have to remember. Okay, yeah, so that's very good. Next one. Encouragement of fluids. Return to regular, normal, usual, general. Okay, these are the words. Regular. Okay, so these are the substitute words you have to remember. Regular, usual, general, common, normal. Okay, so then ambulation, toleration, tolerance. This is another keyword. Able to tolerate medication. Some bodies cannot be able to tolerate medication. So toleration. Okay. Then, so responding to medication well. Responding to medication. Or you can say response. Say to medication. Response to medication. So these are some words we have taken. Yeah. So Soumya, Shamsa, Rajalakshmi, Mahin, Larai, Kamlesh. So we have these students now, 6. So just to give your comments whether these words are useful or not. So these are the words which you can use in sentences. Try to make sentences using these words. So are these words useful or not? So we have carefully selected the words. If you follow these words, every letter you will find these words. Okay. Just you can say yes if you agree, you can say no if you do not agree. Most of the words you write in the letter are in this group. Okay, nothing out of this group. So how to fit these words is important, that's all. So this is the first round, and second round I will give you some more words, that's all. Right. So I'm giving you the things here. Okay, I have given you these words. So all the points I have given here. And then, so you can write the sentences here. The words are already here. Okay, the words are already here. You can just copy this one. Okay, and just copy this one. And even in the WhatsApp group also, I will put these words. Learn these words, write them in your book, and try to use them on a regular basis. So every letter, something or the other should come. You will write some maximum 20 sentences you will write. 20 into 10, 200 words finished. So learn these words, whether you are a pharmacist or you are a physiotherapist or you are a doctor or a nurse, whatever it is. These are the words which you are going to use. So you can just comment, okay, give your feedback, how this session was beneficial, so that I can give more sessions like this. For speaking separate, this is for most for writing I gave now. Give your feedback, because uh, even a magician or a dramatist or a dancer, they needs encouragement like that. Okay, they just dance for 5 minutes, 10 minutes, 3 minutes. They need encouragement. They want something. So, but here we need so that some other people can join. Okay. So your encouragement is needed. If it is really good, or if it's not good, you genuinely tell it is not good, so that we can go to some other things which are beneficial. So give your feedback, please. Okay. I just want you to say whether it is useful for you or not. If it is, many people are saying it is not useful, then we'll stop and we'll see what is useful. Na? This is for your growth, not for me. Okay. So how you feel that, you can take it. So this I'll be putting in the groups also. Yeah, I'll give you 1 minute. In that 1 minute, you can type. So in another 30 seconds, we're going to close that one. And in the meantime, you can improve this one and you can write sentences using these things. So I've sent in the WhatsApp group also. Okay. So that is stars. Okay. Yeah, we're closing now. Copy. Yeah.